Hello students, today we will discuss about the principles of toxicology. First, let's have a look at the definition of toxicology. What is toxicology? The ability of a substance to cause harmful effect by disrupting normal biological functions or damage to the tissues and organs is called toxicology. For example, organophosphates disrupt biological functions by blocking acetylcholinesterase. This is an enzyme which metabolizes the acetylcholine, and in this way, there is excessive nerve stimulation and cholinergic crisis. We will discuss the organophosphate poisoning in detail later on in this lecture. The toxic effects may be the extension of drug therapeutic effect. For example, barbiturates are used as sedatives, but they may cause CNS depression if there is overdose of barbiturates. On the other hand, the drug may cause some tissue damage. For example, vitamin D supplementation can cause kidney stones or nephritis. Following are different organs which are most commonly damaged due to drug overdose or drug toxicity, including lungs, liver, kidney, and CNS. There are certain drugs which may cause lungs bronchitis or emphysema or even cancer in case of overdose, and certainly there are some drugs which can cause liver cirrhosis or liver necrosis if they are used excessively in many cases, and there are certain drugs which can cause chronic kidney failure or acute kidney failure. For example, here is a list provided including cisplatin. This is an anti-cancer drug, amphotericin B, antifungal as well as antibiotic, antibacterial drug. Aminoglycoside again is antibacterial, including gentamicin and amikacin. Iodinated contrast agents, they also cause acute kidney failure in different conditions, and immunosuppressants like cyclosporin and tacrolimus, and there are certain NSAIDs, especially cyclooxygenase, selective cyclooxygenase inhibitor, including ketorolac, which may cause acute kidney failure. There are many drugs which may cause nervous system toxicity, including CNS stimulants like cocaine and methamphetamine, and another class of opioids like fentanyl and heroin. They may cause CNS depression, and at higher doses, they may cause respiratory failure and even death. Let's discuss now the treatment of poisoning. First approach is that we try to remove the poison, and we use different techniques at least to minimize the absorption of the poison in systemic circulation. Before trying anything, at first we give supportive care, and supportive care involve the maintaining patient vital functions like breathing and circulation. And next is that we focus on reducing absorption. To reduce absorption in the systemic circulation, we can use many techniques like inducing emesis or inducing vomiting, or we can use activated charcoal. Activated charcoal binds to the toxin, and in this way, we prevent the poison from entering the blood circulation. In severe cases, we can use techniques of dialysis. Dialysis is the technique in which we can enhance the removal of poisoning from blood circulation. But before using any technique, we have to follow the protocols, and we should consider the contraindications. For example, in case of acid or base poisoning, or in case of some volatile substances like kerosene oil poisoning, MS is contraindicated. So, due to the risk of aspiration and subsequent chemical pneumonitis, so we should follow the protocols of any poison before using any technique. For the treatment of poisoning, the second approach is the use of a specific antidote. For example, we use naloxone as an antidote for opioid poisoning, and N-acetylcysteine is used as an antidote for acetaminophen or paracetamol poisoning. We will discuss different antidotes and their mechanism of action in detail in this lecture. Now discuss different poisons and drugs one by one and their treatment. First is the heparin overdose. Heparin is managed by protamine. Protamine is the drug which works by neutralizing heparin. Protamine is having positively charged while heparin is having negatively charged. Protamine binds to the negatively charged heparin and form a neutral complex. This neutralization reaction form a stable complex and prevent the heparin from exerting its anticoagulant effect. In this way, we prevent the poisoning of heparin. Next one is the acetaminophen overdose or paracetamol overdose. Acetaminophen is metabolized in liver by conjugation process, that is glucuronidation or sulfation, and these conjugates are non-toxic and inert, and they are excreted in urine. If the dose of acetaminophen is very high, a fraction of acetaminophen is converted into highly toxic metabolite which is called NAPQI. The full name is N-acetyl P-benzoquinone imine. Uh, for acetaminophen toxicity, N-acetylcysteine is the antidote. It works in two ways. Firstly, it provides cysteine for glutathione synthesis, and it also forms adducts directly with the toxic metabolite of acetaminophen. Adducts are compounds formed when two molecules like the toxic metabolite and another molecule, in this case is N-acetylcysteine, they chemically bind together. So N-acetylcysteine prevent the liver damage through this mechanism. In case of opioid or narcotic overdose, naloxone is the antidote and it is administered as an antidote. It works by competitively binding to opioid receptors, and it is a competitive antagonist of opioid receptors, and it displaces the opioid from the receptor site, and in this way reverse the toxic effect of opioids, which are mostly. If hypoglycemia occur due to insulin or oral hypoglycemic drugs, symptoms like headache, dizziness, blurred vision, and sweating, etc., may occur by low glucose level. So glucose is the antidote. It restores blood glucose level and counteract the effect of glucose lowering drugs. Next one is the methanol poisoning. For methanol poisoning, ethanol is used as an antidote. It competes with methanol for enzyme like alcohol dehydrogenase. In this way, it reduces the conversion of methanol into its toxic metabolites, which are formaldehyde and formic acid. Similar is the case of ethylene glycol poisoning. Ethanol is also used in ethyl glycol poisoning and as an antidote, and the mechanism of action of ethanol in this case is same. It competes with the ethylene glycol for alcohol dehydrogenase enzyme and preventing the formation of toxic metabolites such as glycolic acid and oxalic acid. Here is the list of toxic effects related to methanol poisoning. The toxic metabolites of methanol poisoning may cause severe metabolic acidosis in victim. It may also cause blindness, and sometimes snowstorm vision may be observed where the affected person sees white spots resembling a snowstorm. There may be CNS depression and multi-organ failure in case of the toxicity of cyanide. The toxicity of cyanide is linked mainly to the cessation of aerobic cell metabolism. Cytochrome C oxidase is involved in the final step of oxidative phosphorylation in electron transport chain to help synthesize ATP in the mitochondria. Cyanide bind to the ferric ion of cytochrome oxidase within the mitochondria, and due to inactivation of cytochrome oxidase enzyme, the oxidation process is stopped, and there is a failure of cellular respiration. In this way, cyanide prevent utilization of oxygen in the tissues and the body, and is unable to produce ATP or energy from oxygen, and this way lead to cellular death. Cyanide poisoning is treated with sodium nitrite, which convert hemoglobin into methemoglobin, and cyanide bind with methemoglobin with high affinity as compared to cytochrome oxidase enzyme. So by using by using sodium nitrite, we spare the enzyme cytochrome oxidase and help the cell to smoothly carry on oxidation process and continue to produce ATP. Now, before telling you about the poisoning of organophosphates, let me tell you that how acetylcholine is synthesized and metabolized, and its concentration in the nerve terminals is optimized. It is very simple. Choline and acetyl-CoA combine in nerve endings with the help of an enzyme called choline acetyltransferase, and after synthesis its excessive amount is metabolized with the help of an enzyme which is called acetylcholinesterase. Organophosphates like malathion and parathiones are common pesticides and used to protect the crops from pests. When these chemicals poison the human, they increase the level of acetylcholine in the nerve endings by inhibiting the enzyme acetylcholinesterase, which is responsible for optimizing the concentration of acetylcholine. When accidentally we inhibit the enzyme with some poison like organophosphate, they increase the level of acetylcholine and cause a cholinergic crisis. That is, increase cholinergic activities, which is manifested in the form of excessive salivation, lacrimation, breathing troubles, and diarrhea and muscle paralysis. The question is that what the treatment of organophosphate poisoning is. There are two options. Number one, we use acetylcholinesterase reactivator, that is pralidoxime, and other option is the use of cholinergic receptor blocker, which is atropine. When we use acetylcholinesterase reactivator, it activates the enzyme acetylcholinesterase and optimize the concentration of acetylcholine in the nerve terminals. It means it metabolizes the excessive acetylcholine in the nerve terminals and optimize the level of acetylcholine. The other way of treating organophosphate poisoning is the blocking of cholinergic receptors to optimize the cholinergic activities. And in this way, we can reverse the adverse effect of excessive acetylcholine release, and effect of cholinergic crisis are reversed.